So our next speaker is Mr. David Cooper. He's Deputy Executive Secretary of the Secretariat of the Convention on Biological Diversity, which is a neutral organization and currently supporting the background work at COP, which we've heard a lot about so far. So today, Mr. Cooper will be speaking to us on strategies to tackle the shared drivers of emerging infectious disease and biodiversity loss. Okay, so hopefully we'll be linking to Mr. Cooper. Oh, there we go. Hi, welcome.
Hi.
Please go ahead.
From Montreal. Good. Can you hear me well?
We can.
Good. So, colleagues, ladies and gentlemen, I'd like to start by thanking Sing Health Duke Global Health Institute of the National University of Singapore for organizing this event, this World One Health Congress. And I'm really pleased to see it seems to be a true One Health event in that it's involving different sectors and different disciplines. I would have loved to have been with you in person in Singapore, but considering the ongoing preparations for the UN Biodiversity Conference, COP15, which you just mentioned, that will take place in Montreal next month. We're very busy with those preparations. And as I'm sure most of you know, COP15 is due to finalize and adopt a post-2020 global biodiversity framework for action on biodiversity, setting the globally agreed goals and targets for action on biodiversity in the coming years towards this shared vision of living in harmony with nature. And that framework is supposed to address the ongoing decline of biodiversity. And we know that this is a decline that threatens human health and planetary health. It threatens to jeopardize achievement of the Sustainable Development Goals. And all of those points, those linkages were recognized actually in the first part of COP15, which took place in China, in Kunming last year, by ministers in the Kunming Declaration. And they committed to halt and reverse biodiversity loss, put it on a path to recovery by 2030. And they recognize that transformative change is needed to do that. And in this presentation, I want to argue why that's important for One Health, why One Health is important for that. And I think picking up on some of the themes from the last speaker, we certainly need an inclusive One Health, one that's inclusive and understanding our relationship with the natural world, with biodiversity. And one where equity is a key part of the principles that we work with. Let me outline a few of my key messages from the start. And the first is that biodiversity is essential for our health, and in so many ways, which I'll briefly outline in a few minutes. And secondly, that the rise of emerging and re-emerging infectious diseases, increased pandemic risk also is strongly linked to the loss of biodiversity. Thirdly, that many aspects of ill health, including disease risk, but beyond that, share the same drivers with biodiversity loss and indeed with other environmental issues such as climate change. But that means, fourthly, that by addressing these common drivers, we can have common solutions to these interlinked crises. And we therefore need much stronger collaboration between the health and environmental biodiversity communities. And in fact, we need a much clearer sense of common purpose in addressing these issues. With such an approach, we could increase the health and well-being of all people while also protecting biodiversity. And that includes, of course, reducing the risk from pandemics. An important element, I think, in what should be our strategy for prevention. And one more point that I will cover, an additional element, and a particular look at one aspect of equity, and that is by working together to ensure that there's a fair and equitable a fair approach to access to genetic resources, both tangible and in their digitized form, and the benefit sharing that arises from the use of those genetic resources. This is a key challenge in the convention, but it's also relevant, very relevant to the health agenda. It's been discussed now in the context of the new pandemic treaty. How do we also ensure equitable access to vaccines, to therapeutics, to diagnostics that are developed on the basis of the access to those genetic resources in the first place? If we can improve that relationship, we can also help improve our preparedness for pandemics. So summing this up, we need a One Health approach, an approach that's inclusive of biodiversity and with a strong focus on equity. Before I go further, I'd just like to acknowledge some of the key sources of information that this talk is based on. One is a publication, joint publication of the World Health Organization and the CBD from 2015, led by Christina Romanelli, Connecting Global Priorities, a State of Knowledge report on biodiversity and human health. And the other is the more recent 2020 IPBES workshop report on biodiversity and pandemics, the report of the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services, the IPCC for biodiversity, if you will. I'd also like to acknowledge the strong collaboration there has been between the CBD, the World Health Organization, and other organizations, FAO and UNEP in the UN, SEA, EcoHealth Alliance, and others. So turning to these links between biodiversity and human health, what are they? They are varied, and they play out at various scales, various spatial and temporal scales. If we want to look at the landscape scale, of course, then ecosystems, forests and other natural ecosystems, but also food production systems, agricultural systems, they depend on a great diversity of organisms to function. Primary producers, herbivores, carnivores, decomposers, pollinators, predators, pathogens. And the services that result from these interactions in these ecosystems provides a number of very important foundations for health. And these are obvious ones: food, clean air, water, both the quantity and quality of fresh water, source of medicines, both traditional and modern pharmaceuticals, climate regulation, pest and disease regulation, and of course a whole host of spiritual and cultural values. All of these have a fundamental influence on human health, our physical health, our mental health. And then if we look at a more intimate level, the human microbiota, the symbiotic microbial communities present in the gut, the respiratory, urogenital tracts, and on our skin, these also contribute to health in many ways. They help to prevent infections, they contribute very much to nutrition, and they help to regulate the immune system. And so whatever scale we look at, biodiversity is a key determinant of human health. And the conservation and sustainable use of biodiversity should be a key objective of our health policies, essentially. And a true One Health approach must consider all of these dimensions. But of course, there's also disease. And as we know, approximately 2/3 of known human infectious disease are shared with animals, and the majority of recently emerging diseases are associated with wildlife. Vector-borne diseases also account for a large share of endemic diseases. And aside from the human suffering these cause massive economic damages. Over the 2 decades before COVID-19, they caused damages of something like $100 billion. So this might lead us to think, well, biodiversity is then a bad thing, isn't it? That it's causing disease. But as we know, it's much more complex than that. While high biodiversity may be expected to increase the potential, the hazard of emerging infectious diseases, some event is needed to turn that into a real risk of actual pathogen emergence. And such risk factors include things like encroachment into natural habitats and contact with wildlife. And we also know that, perhaps paradoxically, sometimes greater diversity, greater host diversity may actually decrease the risk of zoonotic pathogen spillover by reducing the prevalence of pathogens among a diversity of different host species. Although, of course, this is not always the case. This only occurs in some cases. But in any case, we know that encroachment of human activities into ecosystems, the destruction of ecosystems, increases the risk of disease emergence and the spread of diseases. Deforestation, degradation and fragmentation of habitats, for instance. The unsustainable expansion of agriculture that brings humans and livestock into closer contact with wildlife. All of these are risk factors. So basically, we have those common drivers, in this case of increased risk of pandemics, very much the same drivers that are driving biodiversity loss, and often climate change as well. They include land use change, agricultural expansion and unsustainable intensification, wildlife trade and consumption. If we have these common drivers, if we can identify these common drivers, though, we can also look for common solutions. So we can reduce disease risk by conserving and restoring ecosystems and get also many of these other benefits that we have from biodiversity. This includes things like tackling deforestation and addressing the degradation and fragmentation of ecosystems, reducing or controlling the encroachment into natural habitats, increasing the protection of areas of importance of biodiversity, especially intact or near intact areas and areas that have a potential for particular potential for disease emergence. We need to look at potential major infrastructure developments and subject them to an integrated health and environmental impact assessment, looking at how urban expansion or linear infrastructure can be developed in a way that minimizes impacts on the areas that are most risky and reduces fragmentation. We can look at promoting safe, legal, and sustainable use of wildlife. On the one hand, we need to reduce the overall harvest, trade, and use of wildlife, but at the same time, we really must protect the customary sustainable use by local communities, indigenous peoples and local communities. We know many people depend on access to wildlife. Many of the most vulnerable people, many of the poorest people, and also people who have a role in protecting our ecosystems. We also can do a lot to improve the way we manage agriculture with more attention to animal welfare and veterinary care, but also looking at agricultural systems more broadly, as one of the previous commentators said in the last presentation. So these are a number of things that can be done, and all of these require greater collaboration and integration among different sectors of government, in particular the health and environment sectors. I want to just now reflect a little bit also on the COVID pandemic, which has highlighted, I think, for many people, the relationship between people and nature. It's demonstrated that something is not right in our relationship with people and nature, but it's also thrown up a number of paradoxes. Firstly, one thing that the pandemic and its response showed is that governments can act, actually, when presented with a critical need to do so, with an urgent need to do so. We saw that in the health measures that were taken. We saw that in the social protection measures, the fiscal measures that came afterwards, and then in the economic stimulus measures. Government intervention, orders of magnitude more than it had been pre-pandemic, shows that rapid change is possible, not only in terms of government policy, but also in terms of individual behavior of people. It demonstrates that, in fact, transformative change is possible. The pandemic also reminded us on some of the things that are important, including access to nature, but also including who's important in terms of key workers, medical workers, health workers, but also key workers in all sorts of services that provide us with food and services. It's a case also that the pandemic and the responses to it provided countries, the world, all of us, with a unique opportunity to actually then build back better, as the phrase was, right? To improve the way we manage the relationship between people and nature, the way we develop urban areas, the way we promote agriculture. And yet, essentially, we've seen missed opportunities to build back better. Most of the post-COVID recovery measures neglected the opportunities for that positive change. We also missed the opportunity, perhaps, to reinforce the rights and roles of indigenous peoples and local communities who play a disproportionate role in protecting their lands, many of which are critical to global biodiversity, contributes to less poverty, reduces the risk of disease emergence, includes the provision of many essential ecosystem services. The second paradox, if you like, that I want to address is one I mentioned earlier, this related to data sharing and access to vaccines. Again, initially in the context of the COVID-19 pandemic, we saw the world come together with rapid sharing, global sharing of samples and data from patients affected from COVID-19. The sequences from Wuhan were shared in international databases within days. And by the way, they used the mechanism developed under WHO through GISAID in order to guarantee some benefit sharing. Despite this, we have developed, of course, based on these sequences from China, but then from other parts of the world, from South Africa, from other places, diagnostic tools, vaccines, at unprecedented rates, at unprecedented speeds. But access to those products, developed with the help of data from around the world, we've seen as highly inequitable, with the richest countries buying up most of the supply, leaving poorer countries very vulnerable. And this has raised the profile of this issue of equitable access to goods coming from public data, including data that's coming from genetic resources of developing countries. The third issue I want to mention arising from the COVID pandemic has been this point that it shed light on the importance of biodiversity for people, as people sought increasingly to spend their time in the outdoors, in nature, to keep themselves mentally and physically healthy. This, I think, has reinforced the people's understanding and perception of the importance of green and blue spaces in supporting health and well-being. And again, an opportunity for this to be more integrated, mainstreamed in the way we think about health as we go forward. So against that background, under the Convention on Biological Diversity, and the member states, the parties of the convention, have considered these interlinkages between biodiversity and health in a number of important decisions, recognizing the value of the One Health approach, calling for strengthened collaboration between the health and biodiversity sectors at national level and at global level, making a number of policy recommendations in this regard, also looking at improving research into biodiversity health linkages. Currently, we've seen more interest, I think, in the environmental dimensions of One Health. We've seen the United Nations Environment Programme joining the original tripartite of FAO, the World Organization of Animal Health, and WHO. In the new quadripartite, we've seen a common definition of One Health developed by the expert panel. We've seen a lot of emphasis in WHO on these environmental dimensions. We've seen some investment from countries, for example, in the German-funded Nature for Health initiative. Now, in a few weeks at CBD, at the COP15 meeting, we'll see governments developing a further decision on One Health, and in developing this post-2020 global biodiversity framework, which I mentioned at the beginning. Much more recognition of the importance of the linkages between biodiversity and health in terms of disease reduction, in terms of nutrition, in terms of access to green spaces and the like. And also, additionally, greater attention to this issue of trying to address the issue of benefit sharing from digitized genetic sequence information, which is another key issue on the agenda of COP15 that is coming up in a few weeks' time. So we look forward, we hope, to greater coordinated efforts and leadership to catalyze further cooperation between the health and biodiversity sectors. This will be crucial for the improving health. It'll be crucial for protecting biodiversity. As we approach in a few days' time, a population reaching 8 billion, these One Health approaches that are inclusive of our understanding of the natural world, a strong focus on equity, are going to be crucial in ensuring the health and well-being of 8 billionth person and of future generations. So let's hope for more cooperation as we go forward. Thank you very much.